This is a demonstration of a toe pressure taken with a Hokanson toe pressure kit. This is the MD6VR chart recorder with the MD6RP photoplethysmograph. We have an aneroid sphygmomanometer. This is the DS400 and a toe cuff. So we want the patient to be supine, comfortable, and warm. The feet should be warm in order to take the toe pressure. That ensures that you'll get a sufficient waveform. Wrap the toe cuff around the toe. It is okay for the toe cuff to overlap itself. It is not okay for it to be too short. Both ends should be overlapping on the toe. Apply the phototransducer to the pad of the toe, distal to the cuff. If the Velcro strap provided doesn't work to apply the transducer without overlapping the cuff, then a piece of double-sided clear adhesive tape can be used to apply the transducer to the toe. So apply it to the toe, to the transducer, and then to the toe. Turn on the MD6VR chart recorder and you'll see the patient's waveform pulsing on the position bar graph. Make sure that the MD6RP is set to artery mode. This eliminates baseline change, which is not desired in doing a blood pressure with the photoplethysmograph. So make sure that the button is in the in position, so artery mode is pushed in. The high range or low range setting can be adjusted depending on the size of the patient's waveform. This is a healthy toe waveform, so it's very large and we don't need to adjust it into the high position. We can also make smaller range adjustments with the range button on the MD6VR. The smaller the number, the more sensitive the range. So now we can print the waveform. We hit the run button. I'll move the waveform down just a little bit. You can see it's clipping off the top of the chart. And we'll actually make this less sensitive. Good. There is a very good representative waveform, and this is we can use to document the patient's quality of flow to the toe. So we'll stop that, and we'll tear it off and put it on the patient's report form. This is adhesive back paper, so we can apply it directly onto the report page for the patient. This is the right toe, so we put it on the right toe section of the patient's waveform. And now to measure the toe pressure, we hook up the sphygmomanometer to the toe cuff and we run the paper again, and we inflate the cuff until the waveform disappears. That ensures that we've gone above the systolic pressure, and we should go 20 to 30 millimeters above the pressure where flow is occluded. Deflate the cuff slowly. On the DS400, you pull the trigger open just a little bit and it will bleed slowly. It will bleed at about 1 to 2 millimeters of mercury per second. And we do that slowly until the waveform returns. When we see a pulse, we stop deflating to see if the pulse returns. There's the patient's return pulse. It's very small, but it's definitely present because it's repeated. And read on here the corresponding pressure. It's 94 millimeters of mercury. That is the systolic blood pressure in the patient's toe. Now that we've obtained the pressure, we can completely deflate the cuff, stop the chart recorder. We can see on the chart recorder that the patient's waveform has returned to normal now that the cuff is deflated, and we document the pressure on the patient's report form. So the pressure that we saw at the point when the pulse returned is the systolic blood pressure in the toe. That's 94 millimeters of mercury. And those are the steps needed to take a toe pressure with a photoplethysmograph, the Hokanson toe pressure kit. For more information about Hokanson products, please visit www.hokanson.cc.